Are you looking for a tighter tummy like that? A chiseled abdomen? You may be having an abdominal hernia. It is a gap between the muscles of your tummy. If you draw a cartoon character or you see one of these really buff bodybuilding types, you will see a six-pack. But in some patients, the six-pack separates and you have a three-pack here and a three-pack here with a gap in between. That is a ventral hernia or an abdominal hernia. Sometimes it's associated with an umbilical hernia. So you may see at your belly button something protruding like a little lump. These hernias may or may not be serious. If you have a narrow ring, sometimes a little bit of gut or fat may come through that ring. It can't go back in, so it gets kind of stuck. That needs to have an operation. But in most other patients, it's just presenting with a big bloated belly that doesn't seem to go away with whatever exercise you do because the stomach has mechanical disadvantage. The muscles are not joined together. So what we do is through an abdominoplasty incision, we open up the whole skin of the abdomen, we look for the separated muscle, and we restore that or repair that with special sutures so that now the abdomen forms one complete layer of muscle without a gap in between. And this is what we call a functional repair of an abdominal hernia. The abdominal hernia repair operation is quite laborious and takes about 4 to 5 hours. After an abdominal hernia / abdominoplasty operation, the patient has drains which may be there for 2 or 3 days, and this allows any collected blood or serum to leak out and not remain in the cavity and form a seroma. And the stitches are only removed on the 8th to the 10th day. And after that, I tell patients that they can't really exercise for the next 10 or 12 weeks. They can lift their arms, they can do some light weights, they can walk, but not to do anything that engages the core because that would be a bit painful. And they have to wear a corset every day for at least 3 weeks, if not 6 weeks. And following that, when I see them on follow-up, they may need special injections to the scar to make sure that a keloid doesn't form and that the scar is flat and soft.